Go.
Ready? Okay, so this video is to serve to help patients understand how best to use their handheld device after they have a pain pump implant. And so they get this little packet here that's got two devices in it. In the packet, there is an Android phone. This is like a normal Android phone that turns on with the little button on the side. You just push the button, it comes on and it says Medtronic. You swipe across the screen, and when you initially do it, you go through the little tutorials, but otherwise this is the screen that pops up. It gives you a running clock here. On this case it says 2 hours 30 minutes. When that runs down to 0, you're able to give an extra bolus dose. So this is the device that you use to do the bolus dose, okay? On the other side of the pocket is the connector. It's a little thing about the size of your palm. One side's blue, one side is white. There is a button right on the back of it. When we depress the button, this little light will light up, and this shows us that the Bluetooth is active. So if we hold this down and that comes on, this lights up, this blinks, and this connects with the phone. So if we want to give a bolus dose, if it was down to 0 and we were going to give a bolus dose, what we would do is we would take this handheld device with the blue side down. We hold it over the pain pump. So the pain pump is usually in the back, sometimes it's in the belly, but you would hold it over the pain pump. And if this was down to 0, there would be an arrow here, like a play button on a VCR or on some sort of device. And all you would do is you would hit the play button, and right now it's telling us the bolus is unavailable because she's already got a bolus. But if we hit that play button and we held this over the pump, directly over the pump, it would say bolus given, and then this clock would reset to 2 hours 59 minutes. And so once it goes down, you can give it again. Now once you're done giving the bolus, you want to press this button in the middle down again and hold it down until the blue light goes off. When it goes off, it's off. This will go back in this pocket. Now, this device and this device have to be charged. This device has a little portal on the end. The chargers come in the pack with it. And this device, the charger's on the end just like any phone. So once you're done, you slide this back in there. Now the other thing you can do when you look at this is on this screen where it says lockout, if you push the blue eye, it tells you that the bolus is unavailable, it's locked out, okay? If you go down to the bottom of the screen, it says 8 boluses left. This tells you how many boluses you have left in that 24-hour period. And if you hit that blue eye, it'll show you your bolus details. Your bolus duration is 1 minute. You can do it every 3 hours. And if you go here to where it says infusion daily dose and you tap that, it tells you the dose of medication that you're getting per day. And then if you tap where it says bolus dose, it tells you the dose of bolus that you're getting per dose. And then the most important part, if you're trying to understand when your pump's going to run out, if you look here, it says expected refill date, September 25th, 2024. So that's 260 days. So that's how you can always tell when it's going to run out. So then when you're done giving the bolus, you always want to press the button on the side, power it off, and then both are turned off. And so that's the way you give a bolus, that's the way you tell how much is left, and that's the way you tell at what rate you're going. So that's your Medtronics intrathecal pain pump.